Welcome to our online birthing information classes. My name's Danielle and I'm a midwife working for the Mid and South Essex NHS Foundation Trust. During these sessions, myself and my colleagues are going to talk to you about what to expect in labour and birth and the postnatal period. If you haven't done so already, please access our Maternity Direct service, where you can find lots of evidence-based information and health advice. You can also chat to a midwife for non-urgent questions and queries. The link is below. So let's now talk about the pelvis. Now, in the non-pregnant population, the pelvis is a very rigid structure. It's made up of three big, large bones. Now, in pregnancy, you have lots of hormones running around your body, one of them being relaxin. Now, relaxin does exactly what it says on the tin. It relaxes all of the smooth muscle and the joints of your body, including your pelvis. Now, the reason this happens is because your pelvis has to become flexible in order to accommodate the growing baby in preparation for labour and birth. Now, with this hormone relaxin, what happens is it relaxes some of the smooth muscle. Now, you have a very big bit of cartilage in the front here, which is called your symphysis pubis. Now, as your pelvis becomes manoeuvrable, it can cause some discomfort here. This is also what is called pelvic girdle pain. Some of you may be experiencing this at the moment. If you are, you can speak to your local midwife about how to alleviate some of the symptoms of this. Lots of pregnant women will also experience some lower back pain as well. Okay? So quite often in pregnancy, what happens is your bum, I'm going to just pop my baby here for a moment. As your bum is starting to grow and expand, your posture will change. So pregnant women will then start to have this type of posture, which puts a lot of strain and a lot of pressure on the back muscles, which can cause and exacerbate the lower back pain that you're already experiencing. Okay? So what we would recommend to do is try and keep your pelvis forwards and keep yourself upright to try and alleviate some of those symptoms. Again, you can talk to your local midwife about how else you can alleviate these types of symptoms. The reason that this is quite important when it comes to labour and birth is because the pelvis, you have a pelvic inlet and you have a pelvic outlet. Now, when you reach roughly around 36 weeks of pregnancy and you go for your local antenatal checkup, either with your midwife or your consultant, what they will do as part of their antenatal check is they will feel your tummy and they will feel in the lower part of your pelvis to see if your baby is starting to engage into the pelvis. This is a very, very good indicator of the impending labour and birth. The pelvic inlet is a much smaller diameter than the pelvic outlet. So if your baby can descend into the pelvic inlet, there is a high chance that the baby can come out beautifully the other side during the birthing process.
So, something I have been using in my antenatal classes for many years now to demonstrate active birth to couples is a Dutch pelvis. The Dutch pelvis looks a bit like this. We're going to get onto it in a minute. But I start the class and the session by talking about the structure of the pelvis. I might say to my couples that even though there is a hole at the top of the pelvis and a hole at the bottom of the pelvis, the baby doesn't come into the pelvis and just slide its way out, because the pelvis is dominated by the bony structures that we know as the ischial spines, and therefore there has to be some rotation. And to enable an understanding in a visual way of this, what we need is to demonstrate to the couples how that rotation takes place. And I use the Dutch pelvis. So this is the pelvis with the diameters, and you can see that I've got a baby's head and shoulders here. So I'm going to explain that the head descends into the pelvis, and as the head gets into the mid-pelvis, you can see that the shoulders cannot go any further, and neither can the head without some rotation. The baby then rotates around to allow the shoulders to descend and the head to be birthed. Once the head is birthed, again we've got another rotation to allow the shoulders to be released from the pelvis as the baby makes its final journey there through the pelvis. I'm going to say to the couples that I think it's a massive feat of engineering that our babies are enabled to do this. And I want to give them a small round of applause every time they emerge from this bony structure, but they're really well equipped to do it and they know what they're doing as long as we can give them a little bit of help and allow the space in the pelvis. So our mammalian pelvis needs to be upright, and of course flattening it down and putting women on the bed to birth just restricts all of that movement. So hopefully doing a demonstration like this enables couples to understand that upright birth is really crucial for us and for them.
Okay, so now we're going to talk about something that we call optimal fetal positioning. So as we've just seen in that last link, there is a certain set of rotations that the baby has to do in order to navigate through the birth canal. So how do we make this easier for the baby? Okay, how do we make the journey easier? So optimal fetal positioning is trying to get the baby in a good position before the labour and birthing process starts. So your baby should be head down and your baby's back should be facing your front, okay? Quite often, babies don't sit in this position. Babies will quite often sit in this type of position. This is what is sometimes known as back-to-back. You may have heard of that before, back labour or back-to-back labour. Part of the reason why this happens is because we have quite a sedentary lifestyle at the moment. We like to sit back and we like to relax in our chairs and watch the TV of an evening. And what we are effectively doing is creating a hammock for the baby. The heaviest part of the baby is the head and the back. So if you are sitting like this, then your baby is going to be just as comfortable hammocking in your back. Now, there are ways we can prevent this from happening. So what we would recommend from now is spending some time each and every day in a more upright position. Being more upright will help to encourage your baby to stay in the back to front position. So baby's back to your front, back to front. So there are ways you can do this, keeping upright and mobile, walking, and the use of a birthing ball. So with the birthing ball, one thing that we need to remember is the birthing ball, your hips should always be higher than your knees, okay? So you can buy them in different sizes. Please check with the manufacturer. If your hips are not higher than your knees, it's not going to be effective for you. And you are going to be able to sit and bounce on the ball, keeping your back nice and straight and keeping that good posture that we spoke about earlier. And this will really help encourage your baby's back to stay at the front here. It will also help with descent and pushing down into the pelvis to get your baby in a really good position in preparation for labour and birth. Another good one to try as well, if you have a dining room table, you can always spin the dining room chair around the wrong way so the back is to your front. You can put a nice pillow over it, okay, and you can get your partner, your husband, to practice those back rubs on your back while you're sitting in that position. Again, these are all optimum positions to try and get your baby into that really good position in preparation for labour and birth. So, as we've just talked about in the previous slides, it is baby's job to rotate and descend and manoeuvre through the birth canal. It is mum's job to dilate. So we're now going to talk about cervical dilation. So cervical dilation is from 0 to 10 centimetres. Now I'm going to talk to you about the early phase of labour, which is from 0 to 4 centimetres. From 4 centimetres to 10 centimetres is active labour, and that will be discussed further down. So 0 to 4 centimetres is what we call the latent phase of labour, what you know as early labour. So how do you know that your body is going into early labour? What are the signs and symptoms? How are you going to recognise this? So you might start getting a worsening lower backache. You might start getting some periody type cramping, some menstrual type cramps. You might start experiencing some Braxton Hicks, and that is where your tummy is starting to tighten. It's uncomfortable, but short lasting. Your whole tummy will tighten, and then it will relax. It will tighten, and it will relax. It might last for half an hour or so, and then it will taper off. You might also experience your mucuses show. So your mucus plug might start coming away. You might notice that in the toilet or in your underwear. So, early labour from 0 to 4 centimetres, your body is working really hard. Your cervix is a long tubular structure, and not only does it have to dilate, it has to soften and it has to shorten in preparation to dilate and expand for labour and birth. Now, this is what's happening when you're starting to get those period type pains, that little bit of cramping. So as that's happening, your body is going through that process of transition. So your body is going to start doing this on irregular intervals. So it will come and go in phases or waves. And at this point, when it comes in waves or in phases, what you need to do is you need to stay at home and you need to relax. Now, the reason you need to stay at home and you need to relax is because there are certain hormones that need to facilitate this in order for it to progress. Oxytocin is known as the hormone of love, labour and lactation. And oxytocin needs to be in full swing in order for this process to keep going. If you become anxious or nervous, your body then releases adrenaline. Adrenaline is a much stronger hormone than oxytocin. So if your body is trying to release adrenaline, what will happen is it will block all of that oxytocin that your body is trying to utilise in order to progress. So what to do when you are experiencing early labour. So the biggest bit of advice that we can give you is to stay at home as long as possible in the comfort of your own home and your own environment. Again, this will facilitate the flood of oxytocin through your body. You can also use some mild analgesia like paracetamol to help with any discomfort you may be feeling. As we've already spoken about before, keeping upright and mobile is really important, and maybe using your birthing ball. Having a nice warm bath can also really help with any of the discomfort that you are feeling. Walking up and down the stairs is also really good as well. Now in early labour is irregular contractions, and they are irregular in strength and length and frequency. And that is absolutely fine, and your body needs to do that in order to prepare and progress to the next stage of your labour. Now, as we already spoke about, it comes in waves and it comes in phases. And the reason this happens is because your uterus is a muscle and it cannot continually contract for 24, 48 hours straight. So what will happen is your body will take a pause. When your body takes a pause, it means that your uterus either needs to rest or become more hydrated or become more energised. So when your body is taking that natural break and that natural pause, it's either one or all of those three things that you need to do. This is why it's very important to make sure you are well hydrated and that you are eating plenty in this early stage of labour. You'll find a link on the website below which will direct you to a list of all the foods that are really good for you to eat during the labouring process. Another sign that you might be going into early labour is your waters may break. Now, sometimes this comes as a big gush and sometimes this comes as a trickle. Now, when your waters do break, what we would ask you to do is put a maternity pad in your underwear and monitor the loss and the colour. You will need to contact your local maternity triage service just to inform them that your waters have broken, and they will want to know what colour they are. When waters break, the colour should either be clear, maybe with a slightly pinky tinge, or maybe slightly straw coloured, a very muted colour. It shouldn't be green or brown or bright fresh red. Contact your local maternity triage service immediately if this is happening. Now, in not all cases, your waters don't always break first. Sometimes you will get the contractions first before your waters break, and that is fine. If your waters do break, your waters will continue to trickle throughout the duration of your labour, and that is absolutely fine. Remember, you can always contact your local maternity triage service for information and advice with regards to your early labour. So what to pack in your hospital bag? Here is a list of what to pack in your hospital bag. Now, the current advice is to pack for an overnight stay and not any longer. With regards to your car seat, that must be left in the car until you are ready to be discharged from the hospital and go home with your baby. Now I'm going to talk to you about induction of labour. This is if your labour doesn't start by itself, spontaneous labour. What we usually do is offer to induce your labour on the 12th day after your due date. If you are under consultant-led care, you will have a personalised care plan with your consultant and maternity team where you will be given an induction of labour date which is suitable for your needs.